When asked about AIDS, most people told us that they thought it really wasn't a problem anymore. Everyone seems to have it in their heads that AIDS has been taken care of, but there are 50,000 new cases of HIV in the US every year, and 1,000 new cases of young people being tested positive every month.
We had a hard time understanding why this disease was so prevalent in young people. We figured everyone knew to use protection, and we had all heard something about it in a health class. So why does our generation think it's invincible? To make some of us understand what this disease really does, we sought out to make a video that explored the workings of HIV. We asked questions that were too sensitive to touch on in a sex ed class, and we wanted to supply the information that is forced to be left out in school. So let's start with how you get the virus. The most common is unprotected sex. Whether it be vaginal or anal, all genders can carry and transmit this disease. Another is sharing needles or injection equipment. This occurs with people who use these to inject drugs. Infection through blood transfusion almost never occurs in America, but is common in underdeveloped nations. The last is mother to child. If the woman is already infected or becomes infected during pregnancy, she can transmit it to the unborn child in the last weeks of pregnancy or through delivery. However, having HIV does not mean a woman cannot have a child. In fact, the risk of transmission can be lowered to 1% by having a C-section or by not breastfeeding.
To find out more about the diagnosis process, we spoke to communicable disease specialist Jennifer Barnhart.
We'll test anybody that's 12 years and older. When they enter the clinic, they are entering on their own. When they decide they want to get tested, when they come back on their own. We don't allow anybody else in the room with them. They enter as an adult to us, and that's how we treat them. Anything that we discuss with them stays here in this room. I can't disclose to their parents. If their parents come here, I can't even acknowledge that they've been here. They're going to test. 20 minutes later, we're going to give them their test result, and then we go from there. It's a big step, and they're here as an adult.
So is it different when you deliver a result to someone who is younger than it is to a person that's older?
I think it's really individual. We have very immature teens who come in that end up with a positive result. And then we have those that they're expecting it, and they meet the demands of having a positive result, and they take care of business. So it's really individual.
What are the main differences that you see between the youth that come in here to get tested and the adults that come in to get tested?
The main difference, behavior-wise?
Yeah.
With the youth, there's still that it's not going to happen to me, I'm invincible mentality still. It takes a large degree of maturity to say, yes, I'm going to take the medication, and I'm going to take the medication the way I'm supposed to for the rest of my life.
Not only do some people lack in maturity, but they also lack the knowledge to understand that some of the things they think are true about this disease are actually just myths.
God, this is a more disturbing sight than Tom Hanks and E.T. in Philadelphia. Ouch. There you go, you're good.
You didn't touch me.
I don't want to get AIDS.
Thanks to the minimal education we receive in health class, some people believe that you can actually contract the disease through kissing, hugging, or even just breathing the same air as someone who's infected. But the truth is, it can't be spread skin to skin, and there's not enough virus present in your saliva to actually infect you.
Everyone has AIDS. AIDS, AIDS, AIDS. AIDS, 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 AIDS. Everyone has AIDS. And so this is the end of our story.
Another common myth is that only those who sleep around and have multiple partners have the disease. But in reality, anybody who's sexually active can contract the virus. Just think of it this way.
Have you been tested for HIV?
Who, me? No. I don't have anything to worry about. I've only slept with 3 people. Oh! Hey. Hey. Hey.
But I've slept with 5 people.
What the hell?
And I've slept with 9.
You little slut.
And I've slept with 2.
Really?
4 over here.
3 para mí.
Stop.
I've been with 103.
Stop! Are you kidding me? 103? Now what do I do?
Well, since the most common way to get the virus is through unprotected sex, it only makes sense to start with protecting yourself by using condoms every time you have sex.
Muy bien, Señor Condom. Muy bien.
If partners use condoms both consistently and correctly, they can be 100% effective in stopping HIV transmission. But to find out more about HIV demographics, we spoke to Dr. Daniel Pierce.
What group of teens are you guys seeing most of, as in age, race, gender, or sexual orientation?
Here at our clinic, we see anybody who's over 18 years of age. The ones who are under 18 years of age go to the Loma Linda Pediatric HIV or Infectious Disease Specialty Clinic. We see mainly Latino HIV patients. The next group would be the African American. The next group down would be the Anglos. And then most of them are gay, but we see a number of heterosexual young people, and they are usually less well informed. I think people who are gay talk to each other more and have more materials accessible about HIV, and heterosexuals pretty much pretend that it doesn't exist or they don't pay attention, and then they pay for it the rest of their lives. So when you first catch HIV, some people have no symptoms, but a good number have sore throat, fever, lymph nodes, feel like they have the flu, a rash maybe, and they go to the emergency room. Now if they're gay, the doctor may think, well, this is an HIV disease. But if they're not gay, the patient the heterosexual might say, well, I don't have sex, but they're actually having what's called acute retroviral syndrome. And then later, that goes away, but still the virus is in them and slowly depleting their CD4 counts. And then once their CD4 counts drop below certain thresholds, there are risks for certain infections none of us would get. So those are called opportunistic infections, meaning they're waiting to get you when your CD4s drop.
Let's take a moment to look at how the virus actually spreads throughout your body.
An HIV cell looks like a ball with suction cups surrounding the outside membrane. It needs these to bind to other cells inside the body. HIV only contains single-stranded RNA. Therefore, it cannot reproduce to create more HIV cells without a host cell. The main cell used to reproduce is a CD4 lymphocyte, or white blood cell. The CD4 cell contains a nucleus. This nucleus is the control center for the cell and contains its double-stranded DNA. This is exactly what the HIV cell needs to reproduce. Most people contain between 700 and 1,000 CD4 cells in their entire body. So once the virus enters the body, it finds a cell to bind itself to. It then unlocks a CD4 membrane to inject its genetic material into the cell. A special enzyme called reverse transcriptase changes the genetic material of the virus so it can be integrated into the host DNA. The genetic material then enters the nucleus and uses another enzyme called integrase to change the genetic material into the host DNA. When the host cell becomes activated, it reproduces the new genetic material and assembles hundreds of thousands of new virus cells. The virus then pushes itself out of the host cell, taking with it part of the membrane of the cell. This outer part covers the virus and contains all of the structures necessary to bind to new CD4 cells in the body. The old CD4 cell becomes used up and eventually dies. So what are some of the things that people catch when they have the virus and their immune system is affected? Like the things that you and I wouldn't catch.
Oh, right. Funguses. So you have fungus of the brain, of the lungs, of the blood, of the skin. You can have a TB is much more common in HIV. You can have certain parasites of your bowels, of your lungs, of your brain. It's horrible, some of these things. People usually recover from a pneumonia, and then it sets them back a month or two of their life, which in a teen's life is a horrible thing. But if you have a fungus of the brain or a brain infection, like just regular meningitis can be worse than HIV. You can be affected mentally the rest of your life, not being able to walk. You'll be at a child's mentality maybe, or confined to a nursing home because you can't speak and can't feed yourself. It's pretty horrible. But let me mention one thing. When you have acute retroviral syndrome, if we treat you right away and you recognize that that may be what you have, you can just go into the emergency room and say, I had sex, a few weeks ago, and now I have this, and I heard on a video by this wonderful doctor that I might have this disease, that they should check you for certain to see if you have that disease. And if they treat you for a year with HIV medicine, you may never need to be treated again for the rest of your life unless you catch it again, because we've stopped the virus from finding secret places in your body to hide, and so we can wipe it out. And that's wonderful news. So we're trying to catch people very early, and it's hard to do that with heterosexuals. It's much easier with gays, because gays will walk into the emergency room saying, gee, I think I might have acute HIV. Well, heterosexuals pretty much get tested late because they don't realize they have the disease till they get sick sometimes, and that can be years down the road when they're in my age range, meaning the age we see here above 18. And so they come in maybe even sicker, and it's harder to treat them. And also, by the way, we have a number of deaths here. I used to have a death every 2 to 3 weeks back in the 80s and 90s. But now we have 2 or 3 deaths a year, but many times they're young people because they just don't want to pay attention. They're not mature enough to say, I have a disease, I need to take medication every day. Because they just want to be a teen. They want to run around and have friends and text and tweet, but they're not paying attention taking their medication, so they get sick, and it's really sad to have a young person die when they really couldn't take care of themselves.
In there you're safe, and it's true, you'll never be, but you'll never break. Nothing lasts forever.
So in the end, it all comes back to us. Back to our decisions and whether we choose right or wrong. Because we aren't invincible.
So the next question we asked was, what are you going to choose?
Until you set your old heart free. Until you set your old heart